January is Cervical Cancer Awareness Month, the most deadly cancer for women, according to the American Cancer Society. This type of cancer has also had steadily dropping mortality rates since the 1970s due to increased screenings and new treatments. Good Tuesday evening, everyone. Thank you for joining us. My name is John Martin. The state's health department says cervical cancer is the most common type of cancer among women under the age of 40. In addition, DPHHS says cervical cancer was the third most common type of gynecological cancer, with 7 new cases per 100,000 women in Montana from 2014 to 2018. It was also the third most common cause of death, with about 9 deaths each year from that same period. Tonight, Ren Wadsworth introduces us to a survivor of cervical cancer who says a new treatment not only saved her life, but also kept her living.
A cancer diagnosis can stop anybody in their tracks, but the treatments can be just as hard on a person's body as the disease itself. One cervical cancer survivor is singing the praises of a new therapy that works with her body against the cancerous cells. Elise Beckman went to her doctor in the height of COVID, showing no signs of cancer besides a sore and swelling leg. However, the 34-year-old mother would soon find out she had stage 4 cervical cancer. Beckman's cancer metastasized to her collarbone, traveling behind her heart and down to her legs. Due to how far the cancer had already spread, her physician, Dr. Liz Connor, suggested an aggressive form of chemotherapy just a day after Elise received her diagnosis. After 18 weeks of what seemed like successful chemotherapy and what both doctor and patient thought was progress, Beckman's cancer began to spread again, at which point Dr. Connor opted to add a relatively new therapy to her treatment plan.
Once I started immunotherapy, I got my life back. You know, I could work at the salon. I felt pretty much normal. I was tired in the beginning, but now I can come get my infusion. I can go back to the salon and do hair, or go to my kids' games or whatever, and I kind of don't even miss a beat with it now. And I mean, it's much different than chemo.
According to Dr. Connor, immunotherapy works through scheduled infusions and is now often initially taken alongside chemotherapy. It works with a patient's immune system to help identify cancerous cells that are usually able to hide from the body's defenses.
It's a good representation that we're continuing to learn more about cancer, how to prevent it, how to treat it more effectively, and how to focus on quality of life too, and make sure that patients living with cancer have an excellent quality of life. Those really are always our goals as oncologists, and immunotherapy checks really all of those boxes.
And throughout Elise's infusions, her eldest daughter was there to hold her mom's hand. An experience she says has inspired her to dedicate her life to help others who find themselves at the mercy of a cancer diagnosis.
So last year we made these things called passion papers, and it was just talking about what our passions were and stuff, and I wrote mine about oncology and my mom's story, just wanting to help other people like her and helping the overall people who have cancer and help them move through it. Whether it's being a doctor, actually giving treatment plans and helping the patient, or helping the family go through basically like a therapist. With my experience, I could kind of feel what they're going through and just kind of help them through their feelings about it.
Elise says that she's grateful for her immunotherapy infusions that she still receives to this day, which allows her to continue living her day-to-day and be there for her kids' milestones, big and small. Ren Wadsworth, Nonstop Local.
All right, Ren, thank you very much. Both Beckman and her physician, Dr. Connor, stressed the importance of screening for cancer early and staying in touch with your doctor about any changes that you might see with your body.